So now I'm going to teach you how to do an IV stick. So first you need to wash your hands. You need to make sure you have an order for the patient to have an IV placed. After you've checked that, you need to go in the room and make sure you have the right patient, check their armband. You do need to ask them if they're allergic to anything. That's always good practice. And then you're going to need an IV start kit, an extension set or a J-loop, and then you're going to need some type of IV catheter. So you're going to have to determine what size you're going to use based on what fluids you're running through and based on your patient's vein size. You also need a saline flush. And everything that you need should already be in your start kit. So after you've washed your hands, you can open up your supplies. You do need to explain to the patient what you're doing. Answer their questions if they have any. And the first thing that you need to do is prime your J-loop or your extension set and get that all ready. Because once you stick your patient, you don't want them to move and you don't want to be setting up supplies after you've already got the needle in. So all you're going to do is attach your saline flush to your J-loop and prime the little tubing. And then just leave it all connected because you're going to need to flush that in just a second. I go ahead after that and I get my tape ready and set up. Usually 3 pieces of tape is sufficient unless you have a child or somebody that you think is going to really be messing with their IV site. So 3 or 4 pieces of tape. And then you need to be inspecting the patient's arm for the site you're going to use. Remember, you need to start distally and work your way up with your sticks. So remember the 2-stick rule. If you've stuck twice and you haven't been successful, you need to get someone else to come try. So I'm going to try in the hand. That's most distal. You need to place your tourniquet about 6 inches above where you're going to insert. So you want to place it snug. Have the patient make a fist. And then start inspecting for which vein you're going to use. I'm going to use this one. So after I've selected it, and I see that it's nice and straight, I'm going to release my tourniquet. You don't want to leave that on your patient while you're preparing. The next thing you're going to do, put your gloves on. Those are provided for you. If they don't come in your kit, you can just use clean gloves. This is not considered a sterile procedure except for once you stick the patient, you need to keep all of your connections sterile, and when you hook up the tubing, that all needs to stay as clean as possible. Okay, so now I'm going to reapply my tourniquet because I'm getting ready to stick. You're going to take your alcohol swab. In this case, it looks like they've provided ChloraPrep. And you're going to start from the inside and work your way out cleaning. You're going to let that dry. After that dries, you're going to make sure that you insert your angiocath bevel up. And you need to insert at 15 degrees or lower. So you need to be pretty flush with your skin and lined up with the vein. So when you stick, you're pulling your finger back on this front tab as you insert. It should glide in smoothly. You should get flashback in your filter. Once you get flashback, advance the cannula while you retract the needle all at the same time. After you click the needle back, then you need to pop your tourniquet. Remember, click pop. Okay? After you get that done, go ahead and just secure your catheter with 1 piece of tape as far back from the insertion site as you can. You don't want to touch your insertion site. After you've done that, that allows you some more freedom to then take your end cap off of your J-loop sterilely. And then you're going to loosen your site. You need to apply pressure so that blood doesn't leak all out onto your field. And then you're going to connect your flush. After you've connected the flush, then you're going to insert 3 to 5 milliliters of fluid. And as you're doing that, you're looking at your site, you're checking for redness, swelling, puffiness, pain, and all of this fluid should just glide in easily. You shouldn't have any problems with that. Okay. After you've inserted your fluid, go ahead and clamp the tubing. You don't want blood to flow back in here when you take off your syringe. Okay. Then you're going to put on your Tegaderm. It has a place for your initials, your date, and your gauge. So make sure you fill that out. Then you're going to remove the tape. And notice that it has an arrow pointing down. So you're going to put too long. Let me start it. Okay, so I have put my Tegaderm on and I've been careful not to leave a bunch of air bubbles in here because remember we want this a closed system so bugs and germs can't get up underneath our IV site. Then you're going to peel off the remainder of the tape, making sure you don't let air in. And then you're going to label your work. Make sure you put that off to the side because you don't want to cover up this window. You need to be able to see this vein at all times. Then you're going to secure your J-loop so that your patient doesn't hang this on their clothing or anything like that. Always, for good measure, put another piece across my catheter hub. You can tape however you want. You just need to leave a window open here at the end.